Today we are going to discuss halotherapy. Halotherapy dates back to the medieval era. Discovered by Polish miners in the 1800s, it was noticed the salt mines helped the miners with their skin and respiratory health. After the miners had frequent exposure to the salt, the therapy, speleotherapy, was developed. With speleotherapy, people would spend 2 to 3 hours a day in the underground salt caves, and this would last for 2 to 3 months. This was inconvenient for people seeking treatment, so doctors and scientists came up with a new solution called halotherapy. The word halotherapy comes from the Greek word halo for salt. The doctors and scientists noted people could get the benefits of the salt mines in 45 minutes in a halo chamber or salt ring. Studies have shown when people inhale this type of salt air, it has healing properties. Current studies are being conducted to assess the potential benefit of halotherapy. Halotherapy is believed to treat asthma, chronic bronchitis, allergies, cough, shortness of breath, wheezing, depression, anxiety, psoriasis, eczema, and acne. The calming and detoxifying effects of halotherapy can support the immune, nervous, and lymphatic systems. I believe halotherapy relates to Florence Nightingale's environmental theory. Nightingale believed there are 5 points that are essential in achieving the healthful house. They are pure air, pure water, efficient drainage, cleanliness, and light. Florence Nightingale believed that nature alone cures. When looking at Florence Nightingale's nursing theory, it is important to relate it to halotherapy. Nightingale's environmental theory raises awareness for nurses about how a patient's environment can influence their outcomes. The environmental theory focuses on altering a patient's environment to affect change in the patient's health. Being able to care for a patient is more important than the nursing process or the individual nurse. This nursing theory can be adapted to help meet the needs of each patient. The environmental factors that affect a patient is unique to their situation and their illness. The nurse must focus on each patient on a case-by-case basis. This ensures the factors are altered in a way that best suits each patient and their needs. In halotherapy, the salt cave is the healing environment that patients can be placed in to help with their treatment. The salt that is used in the salt cave is pink Himalayan salt that has healing properties from the minerals that are found in it. There are 2 types of halotherapy available to patients. They include the dry method as well as the wet method. The dry method consists of a man-made salt cave that is free of humidity. The temperature is 68 degrees Fahrenheit or lower. Each halotherapy session lasts approximately 30 to 45 minutes. While in the salt cave, a halo generator grinds the Himalayan salt into microscopic particles and then releases them into the air in the cave. When a patient inhales the salt particles, there are claims that the salt absorbs irritants such as allergens and toxins, reduces inflammation in the airways, and absorbs the bacteria found on the skin that can cause skin conditions. Salt is known to produce negative ions, which causes the body to release serotonin. Serotonin is a chemical found in the body that is said to boost feelings of happiness. The wet method is using a mixture of salt and water. Wet method of halotherapy include gargling salt water, drinking salt water, bathing in salt water, using salt water for nasal irrigation, and flotation tanks filled with salt water. Currently, there is no license or certification requirements to be a halotherapy therapist. However, the Salt Therapy Association would like to change this. The Salt Therapy Association is offering a new program to become a certified halotherapist. The STA acknowledges there is a need for more education, knowledge, and awareness. In order to become a certified halotherapist, the education consists of online courses which are self-paced. This education will prepare the therapists to become respiratory educators, breathwork coaches, and community presenters. Halotherapy does not have extensive studies that have been performed. The research that has been conducted is shown to be inconclusive or conflicting in the outcomes for patients. Medical guidelines have not been established for halotherapy. Almost all the studies for depression or skin conditions related to halotherapy are anecdotal, meaning they are based off of a person's personal experiences only. I reviewed the article, A Review of Halotherapy for Chronic Obstructive Pulmonary Disease. The article discusses the use of halotherapy on patients that suffer from COPD. Reports referred to in the article portray inhaled dry salt therapy being beneficial to patients who suffer from COPD. Dry therapy helps to liquefy airway secretions and enhances the expectorant of mucus secretions. According to the article, extensive search of databases did not determine any published reviews for halotherapy for patients with COPD. The article concluded their recommendations for inclusion of halotherapy for COPD cannot be determined at this time. It is determined there is a need for high-quality studies to be performed to determine the effectiveness of this therapy. Because halotherapy is a newer therapy that has not been thoroughly studied, there is no information related to the safety of the therapy. Halotherapy is typically performed in a spa or wellness clinic. Within these facilities, there are typically no trained medical staff on hand to be able to respond and handle any medical emergencies. Halotherapy is thought to be able to constrict or irritate the airways in patients who have certain medical conditions such as asthma or COPD. When researching halotherapy, I decided to visit the Revive Spa and Salt Cave in Shelby, North Carolina. I chose this establishment because it's local to where I live. I decided to take my 2 daughters with me. Both my daughters and myself suffer from anxiety and migraines. My youngest daughter and myself, we both suffer from high blood pressure. My youngest daughter also suffers from asthma and chronic bronchitis, along with chronic sinus infections. I thought this would be a good therapy to experience together and see if we noted any desired effects from it. I admit that I was very skeptical about halotherapy when I first began researching it. After looking at the Revive's Facebook page, I thought the picture of the salt cave looked relaxing and decided it would be a great investment if it worked. Each session cost about $20 for 50 minutes. When we entered into the spa, we were required to fill out a health evaluation form to determine pre-existing conditions and to verify that we were under a doctor's care for them. We signed a waiver form allowing us to enter into the salt cave. We were then led down a dim hallway where we were instructed to place all of our personal and electronic belongings in a cabinet that was then locked. They did not want our attention being drawn away from the salt cave itself. We placed our shoes in a basket under a bench next to the door of the salt cave. The therapist gave us velvet slippers to place on our feet and a thick velvet blanket to take into the salt cave with us. We then entered into the salt cave and were instructed to sit in any zero-gravity chair that we chose. When we were seated, the lights were dimmed and we were told to take our face mask off. The therapist told us to take deep breaths in order to get the salt as deep into our lungs as possible to obtain the maximum desired effect. He stated that once the door was closed, it would not be open for the duration of the session. Once the door closed, me and my daughters had to discuss what we thought about the salt cave. We had to touch the floor of the salt cave because it was several inches deep in Himalayan salt. We noted there were salt lamps plugged into the outlets. Finally, we settled down and began to relax. There was a water fountain in the corner of the room which made a relaxing sound. There was also soft instrumental music playing in the background. I covered up in my blanket and laid back to experience the halotherapy. My youngest daughter fell asleep. My oldest daughter told me that she was able to clearly think about some decisions that she was facing and was able to decide what she was going to do. I laid there making sure to take deep breaths whenever possible. I was finally able to relax, probably for the first time in weeks. I, for a moment, did not feel like I had major stress on me. I became calm and was able to think about the positivities in my life. I was thankful that I had my girls with me and that I had time with my daughters. When the 50 minutes were up, the therapist came out to get us. We were all so relaxed that we argued who actually had to drive home. For the next few hours, the effects lingered with all of us. When we were leaving the spa, we stopped and bought my mother a gift certificate to the salt cave so that we can take her back this week for her birthday. The outcomes of halotherapy include enjoying a relaxing spa treatment. Many doctors are skeptical about the benefits of halotherapy and there is little evidence at this time to support the effectiveness of it. The effectiveness is reported by people who have experienced halotherapy for themselves.